And we're live. So welcome to our voting session. Sorry for the time change, but you know how life is at this point in time. So we're going to start. We have two bills. I'm going to call them a consent calendar. Oh, no, they're just withdrawn. Can someone make a motion to allow the sponsors to withdraw?
Make a motion to withdraw the bills.
Second.
Okay, is there any discussion? All those in favor? Oh, I'm going to vote on these and then we'll take attendance. All those in favor say aye. All those opposed, no. The ayes have it and it's unanimous. And I'm going to open my participant folder so I see hands up. All right, would Melissa, are you ready to take attendance? Could you do that? Thank you.
Sure. Pendergrass,
I'm here.
Ina Melnick,
Here.
Bagnall,
Here.
Barron, Belcastro,
Here.
Bandari,
He's here.
I
Here,
see him.
here,
There you go.
Carr,
here,
Charles,
here,
Chisholm, Collison,
Here.
Hill,
She's here, but she hasn't unmuted to say here.
Mute, yeah, thank you. Here.
Johnson,
Here.
Kelly,
Here.
Kerr,
I'm here.
Kipke,
Present.
Krebs,
Here.
Lewis,
I see Lewis's picture. I don't know why she's not unmuting and saying here. But she's not.
Morgan,
Here.
Riley,
Here.
Rosenberg,
Here.
Saab, Sample Hughes,
Present.
Shalega, and Lewis Young.
Here.
Okay,
Do we have
With-
5 absent?
I'm counting 4.
Shalega, Saab, Lewis, Chisholm, and Barron.
Lewis is here. It's just-
no, she's not really.
Right.
'Cause unless she says she's here, she's not. I have a picture and that's not live. She can come in any time and make her presence known, and you can text anybody if you think of it. But until she says yes, I announced that we were taking attendance, voice vote, roll call. So I can't put her in until we hear from her.
Okay.
Okay, thank you. House Bill 108, Aaron.
This bill alters the Behavioral Health Crisis Response Grant Program by altering the criteria for grant proposals and priorities for awarding grants to local behavioral health authorities and extending the requirement that the government provide an appropriation for the program through fiscal 2025. The bill also alters how specified data must be publicly reported and disaggregated. There were amendments that were adopted in the Public Health and Minority Health Disparities Subcommittee. The amendments strike language that would have required the Department of Health to require that proposals for crisis response grants to contain response standards that minimize law enforcement interactions. The amendments also fund the program at $5 million a year for fiscal years 2023, 2024, and 2025.
Okay, Lewis is in.
Yeah, I see. Delegate Lewis, would you say here? Unmute and say here.
Yes,
Thank
ma'am.
you. Okay, Delegate Penny Melnick, please.
Just quickly, we had a very robust discussion on this bill and everyone voted in support of it. I move the bill.
Is there a
Second.
discussion on the amendments? Or first a second?
Second.
Second.
Discussion on the amendments. All those in favor, say aye. All those opposed, no. Please raise your hands. I see no no's in the panel. The amendments pass unanimously.
On the bill as amended, Chairman, I move the bill.
Second.
Discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. I see no hands. House Bill 607.
You skipped one.
What?
You skipped one, 132.
Did I do that again? House Bill 132. I didn't do it on purpose. Delegate Bagnall.
House Bill 132 establishes that a minor who is at least 12 and is determined by a healthcare provider to be mature and capable of giving informed consent has the same capacity as a minor to consent to consultation, diagnosis, and treatment of a mental or emotional disorder by the healthcare provider or a clinic. A minor younger than 16 may not consent to the use of prescription medication to treat a mental or emotional disorder. The bill authorizes a healthcare provider to decide to provide specified information to a parent, guardian, or custodian of the minor unless the healthcare provider believes that the disclosure will lead to harm to the minor or deter the minor from seeking care.
Delegate Penny Melnick.
Thank you. And on this one, I won't be as fast, but I will be shorter, I promise. I feel that I need to tell you what the law is and what we're trying to do. So currently, a minor has the same capacity in the state of Maryland as an adult to consent to medical or dental treatment if the minor is married, is a parent of a child, or is living separately and apart from the minor's parent or guardian and is self-supporting. A minor has also the capacity as an adult to consent to treatment for or advice about venereal disease, pregnancy, contraception, other than sterilization, drug abuse, and alcoholism, physical examination and treatment of injuries, or to obtain evidence of an alleged rape or sexual offense. They can also consent to treatment for prevention of HIV and for medical screening or physical examination if the minor is in a detention center. That is the law. Also, a minor who is 16 can currently consent regarding a mental emotional disorder. What the bill here does is it basically changes and says we're going to lower the age for consent regarding a mental or emotional disorder to the age of 12. Why are we doing that? We're doing that in order to open a door for a child to be able to speak to a mental health professional. This bill does not change the standard of care of that professional. This bill also says that if that professional sees that or thinks that they should notify the parent, it says a healthcare provider may decide to provide information to a parent, guardian, or custodian of a minor. Under this paragraph, they can go ahead and disclose to the parent that they spoke to the child if it won't harm the child. So it doesn't, prevent a clinician from, involving the parent or legal guardian if it's beneficial to the child. What it does is that it eliminates the barriers for that child. Why this is important? There is a report from the Governor's Commission on Suicide Prevention, Maryland State Suicide Prevention Plan for 2020, that says that in middle school, 22.9% of the students reported seriously thinking about killing themselves. And in the last decade, the suicide rate has gone up more than 50%. 18% of the Maryland high school students reported they have seriously considered attempting suicide in the last 12 months. So, we had a robust discussion and we took a vote. It's really a philosophical difference, those that voted for it and didn't vote for it. And I move actually the bill.
Madam
Okay.
Chairman.
Yes, was that Delegate Saab I heard first?
Do a
Yes.
second on that first before
Excellent.
discussion, Madam Chair.
Madam Chairman.
Wait. Thank you for seconding that, Delegate Hill.
So I wanted to see if I can hold the bill. I haven't seen the final product. I know we heard it in committee, but I'm not on the subcommittee and I haven't had a chance to digest everything in this bill. Can I hold it until the next voting session?
I can't let you do that. I'm sorry, Delegate Saab. I would really like to. There's only one bill that's going to get held, and it's going to be held by me. But what I will do is try not to see it move too fast. And if we need to do something about it later in the process, I might entertain that, but I want to get it to the House floor. I think we need to do that. We're a week away from crossover now. I mean, from sign and die. And I can't afford to do it. I apologize.
No, I appreciate it. It's just an important bill and it's
It
changed.
is an important bill.
Delegate Saab, it was not amended, so it is the same bill that the bill hearing was.
Right, and it did have a lot of opposition, so I
It
just
did.
to take a little bit more time digesting it, but thank you, Madam Chairman.
You're very welcome. I'm not necessarily averse to special ordering it on second reader if we need to. And that's why I don't want to do it now, is because I want to leave us the time that we need to do the right job. And you have the weekend to study up, and you can call the chair of the subcommittee, and she will be happy to discuss this with you if you need her to, because she is an expert, or staff if you prefer. Okay?
Thank you, I appreciate it.
Well, I want you to get what you need. I'm not trying to hold back on that.
Well, I mean, what
Delegate-
I need is a hold, but if that's all I can take, then I'll take what I can.
Thank you
Yeah.
for your grace.
I'm available.
Thank you.
Welcome.
Delegate Krebs.
Yeah, on this, I think if we wanted a consensus bill, the only thing that we're asking for is the word, striking the word may decide and putting the word shall inform the parent. And that doesn't mean you can't go see the person, but at some point for a 12-year-old, we just wanted, if you wanted to get everyone on board, you just, healthcare provider shall provide information to the parent. It's just a difference of they having the information, or they shall at some point provide it to the parent. So that's my hang up, is that the parents don't ever have to be consulted in this, and that simple word would have made it a consensus bill. But without that,
Delegate
I just can't
Delegate
support-
Pena-Melnick, we've got it.
Yes. Yeah, thank you. The issue with that is that it is up to this professional, who, has treated the child, to decide what information to share. So by making it mandatory, you're taking that away. And if it's going to harm the child, the professional is not going to share that information. If it's beneficial, they will. So we have to trust this professional who, we're not changing the standard of care here. So I would object to that.
Delegate Lewis Young.
Thank you, Madam Chair. The Vice Chair essentially just said what I wanted to say. I would object to shall, because sometimes the parents are part of the problem and an obstacle, and I wouldn't want to deny the child an opportunity to help him or herself because a parent stood in the way. Thank you.
Delegate Morgan.
Thank you, Madam Chairwoman. I just had a question with what the Vice Chairwoman just said. So is the option, does the physician, do they have the option here to whether to inform the parent or not?
Yes, so if you look at the bill on page 2, line 28, it says a healthcare provider may decide to provide information to a parent, guardian, or custodian of a minor under this paragraph 1 and 2 of this subsection, unless the healthcare provider believes that the disclosure will lead to harm to the minor or deter the minor from seeking service.
Isn't that a problem with patient confidentiality?
It's not a problem with patient confidentiality when you believe that it may help or harm the child. HIPAA does apply, but because it's a minor, that is the law, why we have it this way, written this way.
It just sounds a little odd that it's up to the treating, I guess, a mental health professional. It's up to their option where to decide to release it or not to the parent, not up to the child, or always, because it's a minor, it should be the parent to start with. It seems very odd that the doctor would be able to choose that, in my opinion.
Thank you.
Thank you.
Madam Chair.
I've got Delegate Morgan. I don't have any other hands in the panel. I've got
You have-
Delegate Hill.
Delegate Hill.
Yeah, I have Delegate Hill's hand and then Delegate Saab's hand is back up. Are you crying there, Delegate Saab?
I was just saying, Madam Chair, to Delegate Morgan.
I'm trying to remove it, but it won't come off. So I still have a question, but I'm not crying or laughing.
Okay, Delegate Hill, I'm sorry.
Yeah, and I think the Vice Chair can, this is consistent with other healthcare laws that we do with minors. And, you know, it's also consistent when medical practitioners, licensed, certified people are meeting with minors. The practice is you encourage them when it's appropriate to disclose to their parents and to allow the information. But if there's a problem with that, if it's going to cause more harm, then you are not obligated to do anything that's going to hurt that minor. And so this is not unusual. It's really consistent with what we do in the other areas that the Vice Chair spoke about. Not that different.
Last bite at the apple, Delegate Saab.
Thank you, Madam Chairman. So if nothing changed in here, on page 2, the second paragraph, it says that subject to paragraph of this subsection, a minor that is 12 years old who is determined by the healthcare provider to be mature and capable of giving informed consent. So what is the guideline for mature to be capable? Because according to the Maryland Psychological Association position, that a preteen child does not have the cognitive capacity to consent to such treatment without parental involvement. They're not developed enough. So what is the standard for mature and capable?
I think that is, thank you, Madam Chairman. That's the standard of that doctor, professional, you know, that has treated children, has the experience, the capacity, and knows what the standard of care is with communicating to be able to determine that, observing the child, you know, watching their language, their experience. I think that is, you know, up to the doctor will be able to decide that. You know, they'll know whether this is someone acting like a 4-year-old or someone that is able to express themselves clearly, their emotions, and to know that they are in trouble to seek help and they can judge the maturity, just like we judge the maturity in our home of our children. So that is, you know, that's up to that professional.
Delegate Penny-Melnick, wait a minute. Delegate Penny-Melnick, do you have some kind of revised testimony or position from the psychologists?
Yeah, the psychologists are actually neutral now. They're not opposing. Psychiatrists are opposing. So we have in this bill, we have people like the pediatricians are supporting, the nurses are supporting, the social workers are supporting, the psychiatrists are not supporting, the Board of Nursing is not supporting. So we have, you know, just a different perspective here in this instance. So we had a really robust discussion in the committee and we decided it's a philosophical difference where how people feel. And if a 12-year-old is able to seek help, you know, the majority of the committee felt that it opens this bill, eliminates barriers, it opens doors, and we want them to talk to a professional rather than finding information on Facebook or talk to someone who doesn't have the capacity to evaluate that child.
So MedChi is neutral on this one, but also can that provider prescribe medication for the?
No, they cannot. That law does not change. So the law says clearly on page 2, line 14, except as otherwise provided in this subtitle, if the minor is under the age of 16, consent to the use of prescription medication to treat mental emotional disorder. You cannot. It does not change the law. They cannot consent.
And what about billing?
Billing, it also says on line 33, page 2, unless the parent, guardian, or custodian of a minor consent to consultation, diagnosis or treatment of the minor, the parent, guardian, or custodian is not liable for any cost of the consultation, diagnosis, or treatment of the minor under this section.
So who pays if the provider?
The provider will be out of luck.
I mean, again, I think there's some issues with that, but maybe we'll just amend it on the floor. Thank you.
Thank you for your questions.
Okay, I don't think I'm going to go to everybody. I'd like to keep this, this is a philosophical issue. I think people are going to have a difference of agreement. I'm going to go back and give Delegate Krebs, and Delegate Chisholm hasn't had a bite at the apple yet, so we're going to
I just wanted to correct something. I just wanted to correct something that was said. The Vice
I
Chair,
don't
mean,
think
the-
I recognized you yet.
Oh, you just said
Delegate
Delegate Krebs. I'm sorry.
I said, I think we'll give Delegate Krebs
Okay.
and Delegate Chisholm a last bite at the apple. Delegate Krebs, I'm sorry.
Thank you. I just wanted to correct something that was just said. It keeps being said, a doctor, a doctor, a doctor. There's nothing in this bill that requires a doctor to see this person. It could be a social worker. So it's not a doctor. So just want to make that clear. Social workers,
You're absolutely right. It's a healthcare provider.
well,
That's
a social worker is not a healthcare provider, but it allows for social workers as well. So I just want to make it clear, this is very, very broad. A counselor, a social worker, it's not necessarily a doctor.
Are social workers licensed in the Health General Act?
Yeah, this applies to, in this bill, as defined under Health General, it applies to healthcare providers. And in the bill, that's an individual who's licensed under Health Occupations Article and acting within the scope of their license to diagnose and treat mental and emotional disorders.
So social workers would be considered healthcare providers.
As long as they're acting within their scope to diagnose and treat.
Yes, they are.
Thank you.
My
That's a
pleasure.
great question. I'm really glad you asked the question. Delegate Chisholm, last bite at the apple.
Thank you, Madam Chair, and I'll be brief. This is not a question of a child being able to be seen by a professional or Facebook, as was just said. That's really, everybody understands the problem. This is just a question of, should we eliminate the parent between the age of 12 to 16? Everybody wants a child that has some sort of mental health challenge to get the appropriate, diagnosis and the appropriate help. But when we say, well, this is going to stop them from going to Facebook, well, they're going to go to Facebook anyway, but that's not the question here. The question really is, are we comfortable eliminating a parent from the equation between 12 and 16? I just wanted to try to correct that. Thank you, Madam Chair.
Thank you, Delegate Chisholm. Okay, so I need to do a vote on this. And I will do the usual with the raised hands in the panel will be the no's, unless somebody tells me they want me to do a voice vote on this, because it is going to be a divided vote. I see hands up. Oh, that's to say no? Okay, Delegate Peña-Melnick, would you, let's see, we moved and seconded it, didn't we?
We did.
Okay, and there are no amendments. So all those in favor say aye. And all those opposed say no, and raise your hand in the panel most particularly. And I'm going to read your names just to make sure that I haven't missed anyone. Delegate Chisholm, Delegate Krebs, Delegate Morgan, Delegate Kipke, Delegate Saab, Delegate Riley, Delegate Shalega. Did I get everyone correctly as a no? Wonderful. The bill passes, but not unanimously.
Thank you.
You can take your hands down now, and we're going to move on to House Bill 607 and 807. And before we get, I can't tell if that's an 8 or a 6. Maybe it is.
Six. It's a six.
Anyway, I have a little announcement to make at this point. I don't think that we will be going into session right at 4:30. I think we have a little extra time that I didn't expect, but I asked because I was concerned. So the good news is we have a little more time, so maybe we'll get through the list of votes today. We'll see. Okay, Delegate 607.
So House Bill 607 originally came in as a PBM bill. The amendments to this bill are striking the bill. They're also changing the sponsor of the bill. So the sponsor will now be the Health and Government Operations Committee. And what the bill now does is authorize a retired judge who retired at the mandatory constitutional age with less than 5 years of credible service to enroll and participate in the health insurance benefit options under the State Employee and Retiree Health and Welfare Benefits Program, and specifies that the retiree or the retiree's surviving spouse or dependent child is entitled to 1/16 of the state subsidy allowed a state employee for each year of the retiree's credible service.
Delegate Cullison.
Thank you, Madam Chair. So just to be clear, judges are appointed. They are required to retire at age 70. So we have a particular instance now and something that could happen in the future, that a judge was appointed after the age of 65, which meant that that judge would not be able to vest in the retirement, or not retirement, but in the health benefit plan for the state health benefit plan. And what this bill does is allow them to vest at the level of 1/16 per year, which is the same as judges who are serving longer. The number of years will be much shorter. So the number of years, maximum number of years this bill could apply to is 4 years, which means they would only get 4/16 or 1/4 of the allowed state's subsidy to their health benefits ongoing, them and their family. So it's just trying to equalize and provide that benefit to judges who are appointed late and then forced to retire at 70. With that, I would move the amendments that took the original vehicle and substitute this bill into it. So move the amendments.
Is there a second?
Second.
Madam Chairman,
Discussion, we'll start with Delegate Saab.
just a quick question. How many judges this would?
At this moment in time, it applies to one judge. There's the potential though, and if a governor wanted to appoint someone who was older than 65. So this bill would, allow that person to become a part of the benefit package at that level.
Thank you.
Delegate Riley. I can't hear you, Delegate Riley. I think you need to
Yeah,
unmute.
thank you. Sorry.
Yeah.
Yeah, would this open up other areas where we could see legislation come down here to Annapolis? I know that there's a lot of other appointed positions that have told me many times that they complain because they're appointed and they're only, they may not make the next appointment after 4 to 6 years. And they have no retirement. They actually have to be there either 16 or 20 years. So I don't know if we're doing it for judge and they're state employees. Several counties, their councilmen, their county appointees, directors and deputy directors, they're all appointed, but yet, we haven't made this exception for them. That's my only question, so.
Well, thank you for the question, Delegate. I know that that might be a concern, but as far as I know, it's only applying to judges. And in fact, I think it was 2015, we had this issue related to judges with respect to their pension, to the potential to have a pension. And at that time, we changed the law for judges, and we haven't seen other appointees come and asking for consideration of this. So I can't say that other future employees won't request it, we just haven't seen it.
Can I
Right.
just wanted to.
But ultimately, they know that it's an appointed position. They only have so many years. I mean, that's the decision that other employees have to make. Okay, well, do I take an appointed position because that happens? Or do I stay in the private sector? Thank you very much.
Understood. Lisa, I think you were gonna
I just wanted to say that the way it was presented to the subcommittee was that this was kind of a cleanup bill, that in 14, when they did this for the pensions they should have probably for the health benefits part as well. So they're just trying to fix what they didn't fix then.
Delegate Krebs, then Delegate Johnson.
And I'm sorry to speak on this because I'm on the committee and I was always comfortable with fixing it for the one person that got caught in the changes, but I was never comfortable with fixing it for people in the future because they know what they're getting into. And I think Delegate Raleigh brought up a good point. It's sort of, they have a final date of age 70, and these people that are appointed have a date of when the next election is. That they're gonna, it's sort of the same thing, that they know going into it, I'm only gonna be there 4 or 8 years because I'm working for Governor X or Y. And it's the same with these judges. If they're 64, 65, 66, they know they get appointed, they may not be able to vest. And I just think you're opening the door. I get it for the one guy that got caught when things changed, but I'm just uncomfortable making this kind of change for everybody in the future.
Well, the good news is that it would be the legislature that would have to make that decision if that were to be done in any future time. So
it'd be hard to, we're opening the door for it. It'd be hard to say no.
Well, we did it for judges on their pension and it hasn't been a problem. So I disagree with you, but that's not to say you're wrong. But we do have the ultimate control. Delegate Johnson.
Thank you, Madam Chair. I just have a question. If we're doing this for one person, I'm looking at the fiscal note and it says that it could go, the estimated for the RX program.
The fiscal note doesn't apply to the amendments, Delegate Johnson, sorry to interrupt you, but that was for the original bill, for the pharmacy benefit manager bill. And the amendments, they don't do a revised fiscal note until third reader.
All right, that's why I was getting confused when it was in here. Thank you.
Yeah, thank you, Delegate, for raising that.
Yeah, thank you, Delegate, for raising that. It's a very good point.
Yes.
Okay. Is there any further? Oh, no, I said that was the last bite at the apple. And Delegate Johnson, you could take your hand down, please, so you don't vote against the bill. So it's been moved and seconded, the amendment. All those in favor of the amendment, please say aye. All those opposed, please raise your hands. I see no hands in the panel.
Okay, move the bill as amended.
Move passes unanimously. And now on the bill as amended, is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, raise your hand. I see 2 no votes, 3. We've got Delegate Saab, Delegate Krebs, Delegate Riley, Delegate Shalega, and Delegate Morgan. And Delegate Chisholm. Okay, the bill passes, not unanimously. House Bill 652. Lisa.
This bill requires the Office of the Attorney General, in consultation with the Maryland Department of Health and the Maryland Department of Labor, to produce a guidance document concerning the application of employee protection laws to the employment of personal care aides by residential service agencies. The guidance will be renewed each year and will be distributed each year to the RSAs. As a condition of licensure, an employee of the RSA with authority over pay and employment practices is required to certify that they have read and understood the document and that the RSA will comply with relevant requirements of the labor and employment article. There are amendments that clarify the certification is required as a condition of the initial license and every 3 years thereafter. The amendments require the certification to be completed on a form developed by MDH that includes a checkbox by which an RSA that receives reimbursement from Medicaid will indicate whether the RSA uses personal care aides designated as independent contractors. The amendments strike language requiring an RSA to report on their rates, the rates that they pay. to personal care aides. They require MDL to submit a report on strategies the Labor Commissioner has taken to educate RSAs and workers on laws governing classification of independent contractors. They require MDH to submit a report on steps taken to bring rates for personal care aides in line with the cost of delivering services and turnover of personal care aides, and they changed the effective date.
Delegate who? Kelly?
Yes, thank you.
Excellent.
So this is a bill that deals with the residential service agencies, the same home care providers we dealt with earlier in the dementia training bill. So folks who are going into people's home, the RSAs use different strategies. Some use employees, some use contractors, some use a mix of both. There was agreement among all the stakeholders that it was appropriate to have the OAG develop a guidance document so that the RSAs would understand the laws around use of contractors versus use of employees. So we had agreement from the stakeholders that that was appropriate. There was some disagreement as to whether reporting on use of contractors, and in particular the wages paid to them, would be appropriate. So the committee amendments strike the reporting that requires that the wages be reported, and modifies it so that there's a checkbox on a form that just notifies us whether whether those RSAs who have Medicaid, who use Medicaid funds, are using contractors or not. So we just will know that information, nothing more. And then we will get a report from the Department of Labor as well as the Department of Health on both this issue of classification of employees from Department of Labor and what enforcement mechanisms are taking place, but also a report from the Department of Health in terms of overall raising the rates for these folks, because we have been falling behind in terms of the work that we have been doing. We were supposed to see those rates go up a lot more than they have been going up. With that, with all of those amendments, we still had a philosophical difference as to whether we should even be dipping our toe into this, I think. So the subcommittee vote was along party lines, and I moved the amendments. Oh, and just to be clear, all of the stakeholders were in support of the consensus amendments, comfortable with the level of reporting that was required and the document.
Second.
Okay. Is there discussion on this bill? We'll start with Delegate Hill.
Thank you very much. And thank you, Delegate Kelly, for the work your committee did. I understand this was quite a bear. Can you explain why it's only the RSAs that do Medicaid billing that have to check the box? What happened to the part where all the RSAs, and why was that decision made?
What? Oh, I'm sorry. Well, that was just part of the negotiation that we entered into to make sure that all of the stakeholders were comfortable. What we have here is a disagreement within the association of the RSAs, right? That some of them run their business one way, some run the business the other way, and there's a lot of tension, I would say. So that was just part of the compromising that we needed to do to make sure that everybody was comfortable with the reporting. And we figured the hook was, of course, that's our interest in it, right? The Medicaid funding from a state perspective.
Okay. Delegate Krebs.
Thank you, Madam Chair. The bill became a much better bill and much more focused. I appreciate that. And I think the nexus is the Medicaid, because it is state funded. Philosophically, I just don't like us getting involved in people in small businesses, how they make decisions, how they want to operate their business. But the bill was very thoughtfully amended, and I appreciate that. Even I'm still going to oppose it. I vote against it, but I think it's much more reasonable.
Okay, both hands can come down now. And we have the amendments moved and seconded. Is all those in favor say aye. All those opposed, no. Please raise your hands. Okay, I have Delegate
The amendment?
on the amendment. This is the amendment, guys. Good catch, Lisa. Thank you. Okay. The amendment passes unanimously. How about moving the bill?
Move the
bill
bill.
as amended. Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hands back up. I have Delegate Saab, Delegate Chisholm, Delegate Riley, Delegate Shalega, Delegate Krebs, Delegate Morgan, Delegate Kipke. The bill passes. Okay. House Bill 1030, Delegate Saab. I'm sorry, Delegate Tyler. Let's start with Tyler and then go to the delegate. Long day.
House Bill 1030 reforms the appointment and nomination process for the State Board of Dental Examiners. There were no amendments. and it was
favorable.
Voted unanimously in subcommittee.
Delegate Kelly.
Thank you. This bill was unanimous in subcommittee. It is going to change the process that the dental board does to make it the same as the Board of Physicians process and eliminate the elections that don't result in anything other than a recommendation that the governor does not need to accept. Move the bill.
Second.
Are we moving the bill or the amendments?
There were no amendments.
Oh, I thought that, okay, fine. Delegate Krebs, your hand is up.
She's just excited to vote on the bill.
All those in favor of House Bill 1030, say aye. All those opposed, no. Please raise your hands.
Madam Chair,
Seems,
I know we're in the middle of a vote and I haven't been recognized, but I was just hoping maybe we could consider a committee amendment to remove the name of the sponsor and to put Health and Government Operations in its place.
We can entertain that April 14, Delegate
Can I
Hill.
get a second?
Second.
It's not April 1st.
that's right, we missed that by one day, too bad. Great idea, but I think we'll leave things as they are. It's a little late in the process at this point. The bill passes unanimously. And we thank you for that, Bill, because we need to make progress on that issue this year.
Thank you. I appreciate it. And I appreciate Delegate Kelly's hard work too, and everyone else in the subcommittee and staff.
Senate Bill 41. Aaron.
This bill is identical to House Bill 132, which was earlier in the voting list.
Okay, and you know who you are, who have to put your hands up. You want to move?
Madam Chairman, can I hold this bill?
Yes,
Okay.
you can. It's a Senate bill. We have a little more time. If you
Okay.
hold this bill, I will let you hold it until our next voting session. Thank you for asking.
Thank you.
You were joking, but.
He's joking, he's joking, and it's only one hold per member.
I
He
wasn't
even has
joking.
to Three this session.
No, it's one hold on a bill per member, not one hold.
Delegate Hill, you're lucky you don't have any bills on the agenda today.
Well, I'm going to pick and choose, and they're House bills, and I'm not going to let them be held. But this bill, I think it can wait. I'd like to see it get through, but if it helps you to hold this bill, that's fine.
Thank you. I appreciate it.
You're very welcome. House Bill 49, I am holding. So we'll now move to Senate Bill 49, I'm holding. Senate Bill 84. And that is Lisa.
So this bill has amendments that conform the bill to the House bill.
Usually Delegate Kipke moves the amendments. But he's not there doing it, so.
Move the amendments.
Any discussion?
Second.
All
Delegate
those in-
Kipke was being a doula today. He was a little busy doing some online doula work.
Research.
All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously. Delegate Kelly,
What?
didn't we just adhere it, conform it to our bill?
Yes.
With
Oh,
an
you want me to
amendment?
move the bill as amended? Got
That'd be
it.
Okay, so you're doing that. All those in favor say aye. All those opposed, no. The ayes have it. It seems to be passing unanimously. Senate Bill 132. Tyler.
Senate Bill 132 authorizes a notary public to list their business address or phone number as their primary contact when a third party contacts the Secretary of State to get in touch with the notary. If a business address is not provided or not selected to be their primary, then the notary's home and phone number would still be listed and provided.
Move
Delegate
favorable.
Rose,
This was
Second.
unanimous by the subcommittee. Move favorable.
is there a second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. Senate Bill 139, Tyler.
Senate Bill 139 is substantially identical to House Bill 540, which the committee and House passed unanimously. There's just technical differences in the bill.
So
Bill.
is there an amendment to do the technical, or are they in?
No,
there?
the Senate bill came with the fix already.
Okay. Delegate Kelly,
Move the bill.
Second.
discussion. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 284, Tyler.
Senate Bill 284 is cross-filed with House Bill 660. The bills define the term service dog, support dog, and therapy horse for purposes of the Maryland Veterans Service Animal Program. The Senate version came with one amendment that provides that support dogs be individually trained. The bill moved from subcommittee unanimously.
And this amendment conformed the treatment of support dogs and service dogs, that both would have to be, in both instances, they'd have to be individually trained. I would move the bill.
Second.
Any discussion on the amendment, on the bill? Sorry, there's no amendment. Seeing none, all those in favor say aye. All those opposed, no. The ayes have it. The bill passes.
Please.
Senate Bill 286. Aaron?
This bill with amendments is identical to House Bill 108, which was earlier on the voting list.
Okay, is there any discussion?
Move the bill.
Second. All those in favor say aye. All those opposed, no. The ayes have it. Senate Bill 286 passes unanimously. Senate Bill 3.
Chairman, okay, never mind.
Sorry, did I miss something?
Krebs had her hand up.
I had a question. I know it passed, but I missed it on 286. Is this a limited amount of time that this funding is mandated for?
It's 3 years. It's through fiscal 2025.
And where's the money coming from?
It's general funds.
Okay. I missed it on
It's
the,
existing funding. It's current level funded.
it's just mandating it for the next 3 years.
Correct.
I'm hearing different people speak. This bill, Delegate Pena-Melnick, did you answer this bill? Did you answer the question? Since you're the chair?
Sorry, 1 second.
I just want to make sure that.
It is level funded. It is $5 million. It's coming from the general fund. We lower it from like 8 million, 9 million to 5 million.
Okay. Everybody good? Great. Senate Bill 379, thank you, Delegate. Tyler.
Senate Bill 379, as amended in subcommittee, is identical with House Bill 161 as it passed the House.
Move the bill.
Second.
Do we have to move the amendments?
We do. We need to move the amendments first. So I'll move the amendments.
Second.
All those in favor say aye. All those opposed, no. Raise your hand. The amendment passes unanimously.
Move the bill as amended.
Second.
All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 384, the last bill on our list.
No, this is
Another page.
The last bill.
I did that earlier today
It's the
too.
last bill on page 2.
Keep being optimistic that I'm going to see lunch sometime today. Lisa.
So this bill has amendments, and with those amendments, it is identical to House Bill 652 that we voted on earlier in this voting.
Delegate Kelly.
So we need to move the amendments.
Move the amendment.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The amendment passed unanimously.
I will move the bill as amended.
Second.
Discussion? All those in favor say aye, and all those opposed, please raise your hands. And I suspect we should see some hands.
Yeah, they're coming.
Yep. I have Delegate Saab, Delegate Chisholm, Delegate Kipke, Delegate Riley, Delegate Krebs, Delegate Morgan, Delegate Shalega. Okay, we're now moved to the last page of the vote list. Senate Bill 507, Lisa.
So this bill is the cross-file to House Bill 554. It came over from the Senate a little differently than we passed the House bill. In addition to the requirements of the bill, it also requires the Office of Healthcare Quality to notify the Consumer Protection Division of the Office of the Attorney General of the appointment of an assisted living program as a residence representative payee within a reasonable time after being made aware of the appointment. And then the Senate also then clarified that language when it put it on the House bill. So there is an amendment for this bill that is just clarifying the notice requirement I just explained.
Delegate
So, move the amendment.
Second. Is there any discussion? All those, oh, there's a hand up. Delegate Krebs, did you want to say something? If you do, you need to unmute.
Sorry, I had my hand up by accident.
Okay. All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
Move the bill as amended.
Second. Discussion? All those in favor say aye. All those opposed, no. The ayes have it. If you are voting against this, please raise your hand. All right, it's unanimous. Senate Bill 523. Tyler.
Senate Bill 523 with the amendments adopted in subcommittee is identical to House Bill 600 as it passed the House.
Move the bill.
Move the amendment.
Delegate Kelly, you move the amendments.
We need to move the amendments, please.
Second.
Thank you.
Madam Chair.
A hand or heard a voice. Who was
Yes, that's me. That would be Delegate Sample Hughes.
Delegate Sample Hughes.
I have a possible amendment on it.
You may, and you may hold it until our next voting session, which I think may be Monday or maybe not, because we may not have things coming out of subcommittee. But yes, this is a Senate bill, so I will let you hold it as that's what we decide. What I decided today is that we can afford that.
Okay.
Okay.
Thank you.
You're very welcome. So that bill is held until our next voting session. Senate Bill 652, Lisa.
This is also a cross-file. It's a cross-file to House Bill 599, but the Senate did put an amendment on it that clarifies that the materials that are developed by the Maryland Department of Health must be understandable to individuals with limited literacy skills. So there's no amendment, but just to let you know what this bill is a little bit different.
Good, thank you. Delegate Kelly.
Move the bill.
Is there a second? Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. Bill passes unanimously. Senate Bill 745, Tyler.
Senate Bill 745 is cross-filed with House Bill 1039. The bills make a number of revisions to the massage therapist's title. The amendments restored language that affirmatively declares it is optional for insurance carriers to decide whether their policies will cover massage therapy services and treatments. It was passed unanimously in subcommittee.
Delegate Kelly.
Thank you. So the amendment is just restoring language that was in the code that we struck when we passed the bill before. So we want to make sure that's in there because it makes the carriers more comfortable. Move the amendment.
Second. Discussion? All those in favor of the amendment say aye. All those opposed, no. The ayes have it. It passes unanimously.
Move the bill as amended.
Is there a second? Discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. And the last bill of the day is Senate Bill 57. Aaron?
This bill with amendments, has amendments that will make the bill identical to its cross-file House Bill 1280 as passed by HGO.
Delegate Penny Melnick.
Okay. Thank you. I'm so sorry. I apologize. I was.
So it was not in subcommittee. It was not in subcommittee. It's just.
Oh, of course. Right.
Okay.
Okay, so we're going to make it look like the House bill, right?
Correct.
So do
Any
we have to,
discussion?
so we have to move?
Yeah.
Tell us
you
what the
need-
differences were.
Actually, when the bill was in HGO, they were very similar, and then they both passed right before crossover. And during Public Health Subcommittee, Delegate Hill had offered some amendments with just some clarifying language that they would look at the validity of some of the screening tools that were used. So if you look at the amendments that are in the package, just a few words that were added for clarification.
Okay.
Amendments, that's okay.
Delegate Penny Melnick, would you like to move the amendments?
I move the amendment, Madam Chairman. Sorry, Chairman.
Second.
And I see that we have a hand up. Delegate Krebs, did you want?
Sorry. No, sorry again.
You're going to get a trophy for this at the end of the year. Seeing no discussion, all those in favor say aye. All those opposed, no. The amendments pass unanimously.
I move the bill as amended.
Second.
Again.
Any discussion? All those in favor say aye. All those opposed, please raise your hand. The bill passes unanimously.
Thank you.
And that ends the voting session.
No, not quite.
Oh, we have concurrence calendars or something. Yes, I forgot that. I don't have a list of those, do I?
I think we can,
You're going to go through them and then you're going
Yeah.
to give me the piece of paper or whatever it is I need because at some point I need something. Let's start with whoever wants to start, whichever LA.
I can
I have
start.
no clue what we're doing here now.
So the first one is House Bill 135, which is the pharmacist administration of self-administered medications and maintenance injectable medications. We actually just passed the cross-file, the Senate conforming it to the House bill. So we are actually going to reject the Senate amendments and move not to concur.
Okay,
To not concur.
is there a second?
Second.
And all those in favor say aye. All those opposed, no. Please raise your hand. We will not concur and it's unanimous. And I guess that means we create a conference committee, right?
We'll have to come up with, yes, who you want to conference.
Okay. Yeah, we'll figure that out.
Tell
Okay,
them we're not budging, Madam Chairman.
good possibility, delegates.
We need to move this bill. We need to work it out.
Would be
So the other
nice.
bill I have is House Bill 599, which is public health, long-term care planning. And this one, we also just passed the cross file. And I just, this is the, there was just a little bit of a tweak to the language that is clarifying that the materials published by MDH are understandable to individuals with limited literacy skills. So moving to concur with the Senate amendments on that one.
Move to concur.
Excellent.
Second.
Okay, all those in favor say aye. All those opposed, no. Please raise your hand. We will concur on that bill. Anything else?
House Bill 540, occupational therapists, interstate compact. It was purely technical changes that they found in the House bill, HB 540.
Move
So we
to
need to move to
concur.
concur. Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. We will concur.
House Bill 871, we passed the Senate version that already had this amendment. They added a reporting requirement for the Procurement Improvement Council.
And we already added the amendment. I mean, it was in the bill we passed, so that we
Yes.
want to move to concur. Okay.
Yes.
I move to concur.
All those in favor say aye. All those opposed, no. The ayes have it. We will concur.
And similarly, House Bill 989 also came The Senate version came with a reporting requirement that HGO passed favorably. And so concurring would, you would be concurring with adding that reporting requirement to the House cross file.
Someone want to move that?
Move to concur.
Discussion or second?
Second.
Anyone? All those in favor say aye. All those opposed, no. We voted unanimously to concur. Is that it, Tyler, for you?
Thank you. I think we're gonna. Thank you.
Wait. Lisa's Hopwood.
I have one. House Bill 849, this is public health medical records fees. The Senate amendments retain some provisions in current law related to medical records and fees that were intended to be retained when the bill was amended in the House. So it's technical corrections.
Okay, so you want to move to concur?
Move to
To
concur.
concur.
Question.
Second.
Question. Who is that? Delegate Hill?
Yes, Aaron, because those were the things we kind of went over. What are they retaining? That we took some things out very deliberately.
So that it just goes back to that section of the code. You retain current law. The bill, as you recall, just it just, once you pass the bill, all it did would require the healthcare provider or representative. It would prohibit them from charging a fee for providing the copies requested by the patient, and that will be used to support SSI. So the bill, as amended, that's all it was supposed to do. And then it retained current law related to the fee. So it was just like a couple brackets that we missed, honestly. And we went over that. I went over it with finance staff and also with the proponents who had amended the bill.
The radiology stuff is just as we had it. There was stuff about x-rays and radiology stuff. So
that all is, yes, that's all.
All right,
A couple of brackets that we missed, honestly.
All right, thank you.
Delegate Rosenberg, did you want to add anything to that?
Well, just to say that the amendment is okay with the Mental Health Association, which is the entity that I worked with on the bill from the outset. So they are fine.
And
As Aaron said.
the practices are
But
fine.
you
The
need
ones
to
that
get
have to-
recognized. You need to get recognized. Delegate Hill, did you want to speak?
I'm sorry, Delegate Rosenberg, what about the other folks? The fees had to do with what the practitioners could and couldn't charge for the time and effort it takes. So were they okay with the changes too?
I haven't heard from them, but these are, as Hopwood said, these are technical changes to the bill, to what was bracketed. The intent is to leave prior law unaffected, and that's what this technical amendment does, is my understanding. And Aaron nods her head yes.
Okay, so we're going to assume that's accurate. We have no problem with that. And Delegate Hill, you have all weekend to look at it if you are comfortable with something. So maybe you can get a reprint.
I can do that.
Aaron, could you do that to her?
Yes.
Get it to Delegate Hill. That would be great. You might get it to Delegate Rosenberg too, just so he has it in front of him, if it's subcommittee, which I presume it is.
I'd like it too. Can you send it to everyone?
How about sending it to everybody? That's a good idea, Delegate Shalega. Thank you.
I will do that.
Okay, so that said, I think we're done. I think I can give you as much time as there is between now and session, and I don't know what that'll be, but enjoy your 15 minutes or so. Thank you very much, everybody, for trying so hard to get the work done today. I really appreciate it. And congratulations to Delegate Krebs, who gets to maybe go home and be with her family for Easter dinner in church. Okay, bye.